Sir, এতিয়া চাওক এতিয়া হ'ব
এতিয়া হৈছে yes thank you
যাক দি লাগে মই প্ৰিন্সিপাল ছাৰক ভইচ শুনি আছে জানো আপুনি নাই ছাৰক মই আস্কটো মিউট দিছো আস্কটো ছাৰক আনমিউট কৰিব লাগিব
কো শুনা নাই
নিজে কব নোৱাৰে
Hello.
All right, I believe sir has sir's like speech could not be heard, so I think we need to move a little ahead. We are running short of time, so before we proceed, I would like to introduce our resource person for today. We have amidst us Miss Megha Kashyap, who is currently a Felix Research Scholarship holder and is doing her PhD in Gender Studies from the School of Oriental and African Studies, University of London. Her research is situated in the broader frame of gender and borderland studies in South Asia. She is a postgraduate in social work from the Tata Institute of Social Sciences, India, specializing in community organization and development practices. She is also a recipient of the Linné Palme Fellowship from the Lund University, Sweden in 2015, and a scholarship holder from the KIT Royal Tropical Institute, UN Women, and Oxfam, Canada. This was to pursue a professional development program for genders training at KIT, Royal Tropical Institute, Netherlands in 2018. Prior to joining London University as a PhD scholar, she was working as a program coordinator for the gender justice for Oxfam India, leading the Oxfam India gender campaign, Bano Nai Soch, and was managing a multi-country project that aimed to create safe spaces for women and girls to take action on violence against women and girls in 5 states in India. She was also a global youth advisor for Global Partnership for Education, where she contributed massively to GPE's youth advocacy plans and education financing advocacy initiatives during the period of July 2017 to January 2019. Additionally, she was also an external evaluator for Systematic Approaches for Equality of Gender project of IQAC.org that basically works to prevent gender-based violence in schools in 5 European countries. Prior to this, before her tenure at Oxfam Delhi, she was also leading a program with the government of Sikkim in 100 government schools on an innovative peer education model to combat drug abuse issues among school-age children. She also worked with a child protection non-governmental organization on cases related to child labor and child sexual abuse in India. She is also the founder of a non-formal education center and has worked with community-based organizations in Northeast of India on issues of gender and development. From 2012 to 14, she worked as a project associate on a UN Women project on gender budgeting with Northeast Network, a feminist organization in India, to analyze budget allocations made by the government towards women in health, education, and livelihoods, and organize awareness camps on reproductive health and hygiene for women. A very, very long and an exhaustive work done by a very, very young woman. We are extremely pleased to welcome Ms. Megha Kashyap. So Megha, the floor is all yours. Thank you.
Thank you so much. That basically is my whole CV you read out from my LinkedIn bio, but thank you so much. It's really nice to be with all of you here. I hope everyone's keeping safe, staying home, washing your hands, wearing mask, and doing everything that is expected from us by the government. I will go turn off my video because I'm really not comfortable speaking with my camera on, so my audio is going to be on. At any point of time, if someone has any questions to me, please feel free to interrupt me or just write to me in a private chat, and I can take the questions once I'm done with my presentation. I can promise you.
Before we move ahead, I would just like to intervene here. I think we can keep the queries and questions for after you are over with your delivery.
Okay. Yeah, okay.
And there will be some kind of a semblance, and everybody can just put in their questions and all or queries in the chat box itself.
Sure, that would be great.
Okay.
And yeah, I mean, I promise it's going to be a short presentation because it's 6 a.m. here in London and I just woke up. So I'm going to keep it very short. And yeah, so yeah, I'll just turn off my video first and then, okay. So I have my presentation in 3 parts. This is an ongoing work that I'm doing with University of Mexico, where I'm presenting. I'm taking lectures with the students there, and this is a part of the lecture that I'm doing with them. This is gender and biopolitics in a post-COVID world. I have structured my presentation in 3 parts. First part, I'm going to talk about what is biopolitics. I'm going to contextualize what biopolitics is all about. I'm going to talk about different models of power that's being used in a pandemic, which is a biopolitical form of power. Then I'm going to move and talk about gender and biopolitics, the frame of looking, why is it important to talk about biopolitics and gender, the conceptual frame, how it is indispensable. And lastly, I'm going to talk about biopolitics, India and the citizenship contestations. Also is because it relates to my PhD work as well. So I'm kind of, exploring what pandemic citizenship looks like in, what's the whole citizenship contestations happening in India in a post-COVID world. So yeah, let's begin. So biopolitics, this is a term introduced by a French philosopher called Michel Foucault. He introduced the concept in his book called History of Sexuality in 1976. It basically means there was an emergence of new political aims and strategies in Europe in around second half of the 18th century, where modern societies, they kind of created new forms of technical and political possibilities to regulate life. Like, put very simply, it's like how governments control who must live and who must die. I mean, who gets to decide what section of population is eligible to live and what section of population should be not given access to opportunity so that they die. So you don't directly kind of discriminate them, but in a way kind of have policies and schemes and ways to kind of control life on earth. And it's all the more relevant now in during COVID, because COVID kind of exposed the realities of government. We have seen how plenty of governments all over the world came up with policies which kind of really threw light on who cares about life and health of many. Because especially like in Europe, we have seen how Italy or Spain handled the whole COVID pandemic, letting a lot of care home inmates isolate themselves, and there were no institutional support. It's about how governments decide whose bodies are more productive and whose bodies are more needed to create wealth in a capitalistic society versus who are not needed. So that is biopolitics. Moving on, during a pandemic, there are Michel Foucault also kind of came up with this idea about how there are 3 forms of power that operates within a pandemic, especially relevant in COVID, because we have seen different governments using different models of power. So one of the first forms of power that governments used during a pandemic is the plague model. This relates relates to this whole utopia of like perfectly governed cities during plague, which broke out in Europe in 18th century. And we saw how there was a new regime of power which came out during the plague, which was a form of disciplinary power, where people who were not just infected, also people who were non-infected were locked up. Everyone, I mean, children, soldiers, workers, prisoners, poor, everyone was subjected to rigorous discipline by the state. In this form of power, it is important to understand how, you know, governments kind of really enforce very strict, very regulatory, disciplined kind of norms for citizens, and there were uninterrupted control of all borders and crossings in cities, and, you know, governments demanded that there should be strict confinement of citizens in their homes. The whole public space became a very segmented, immobile, and frozen space. Nobody could move from their homes. You know, everyone was confined. And, you know, if someone moves from their spaces, you know, you risk life. So this whole burden of infection fell on individuals. You know, they were punished if you move out from one zone. And if you go out from your home, then you go somewhere else and you'd be punished. So the same thing we are witnessing now. During Corona, because if you look at the complete lockdown of Wuhan, Italy, Spain, India, Brazil, Egypt, Hungary, Poland, Russia, everywhere, wherever governments kind of said that, you know, there will be complete lockdown, they were using plague model of power. Somewhere I feel that it's important to have the plague model, of course, to contain the whole infection, but also without any statistical knowledge, without knowing that, you know, how the virus spreads, who is infected, who is not infected. It is very difficult to introduce liberal measures. However, having said that, it still remains a threat and a danger, because if you look at Morocco, what happened was when lockdown was announced, there were military tanks on the streets, and, you know, in Israel, prominent voices, they were talking about Netanyahu kind of planned a coup. Then in Hungary, Viktor Orbán, he using Corona as a, you know, as an excuse, he wanted to transition his government by decree. And there was this attorney general in US called General Barr. He was seeking permission to hold prisoners indefinitely without trial. Even in India, I've seen, I was following Twitter some weeks back. I've seen how some of the IT cell people and, you know, some of the people who follow the current government, they were saying how we should waive off 2024 elections because the government is trying to stabilize the economy with Corona and all of that. So you see how this whole pandemic became an excuse for governments to really use it for their advantage. So that is the plague model of power. The second model of power is the smallpox model, which is relatively liberal. This was again in 18th century when smallpox broke out in Europe. There were a lot of statistical observations, and, you know, governments could kind of do test, kind of observe people who got smallpox, how it was infected, how it spread. And, you know, there was no complete lockdown wasn't announced, and, you know, the whole smallpox pandemic was controlled through vaccination. So in that model, what happens was power kind of coexisted with the virus, with, you know, it existed within the economy, we existed within everyone. And it was only possible because, you know, there was extensive collection of data, you know, there were statistics and medical campaigns were run. But the only thing here also was that, you know, there was a different form of power which was being used, because even within the populations who were infected, they were subjected to trials, medical trials, and, you know, collecting of data, massive tests. And this individuals were disciplined in a particular way. So in current times, we can say Singapore and South Korea, they adopted the smallpox model where governments did not impose complete lockdown, but there were certain selective restrictions on populations. And this was also possible because they have done massive tests, you know, systematic tests were done. I was reading this news of South Korea where the government literally went to like every household and did tests there. I mean, everyone was subjected to COVID tests, and they had massive data, so they could use kind of the smallpox model where they did not do complete lockdowns. The last model is the leprosy model. this is where power kind of separates healthy from the sick, and people who had leprosy, they were excluded from the society. They were kind of thrown out of the city gates, and nobody cared for them, and they were excluded from mixing with the healthy population. Somewhere during Corona, I think the leprosy model is also lurking in the background. Every now and then we have seen how a lot of countries kind of came up with this idea about that, let old people die to save the economy, especially US. We have seen a lot of anti-mask, anti-vaccine, anti-lockdown measures. Protesters in US, I mean, there were a lot of videos on Facebook and Instagram where people were saying that, mask is against God, you are against God, system of humanity and all of that, it promotes pedophilia and stuff like that. So yeah, this whole idea about excluding a certain section of population from mixing with the rest of the population is a leprosy model. And governments kind of, some of the governments during Corona used this model, especially Spain, Italy, and US, where they left, people in retirement and nursing homes on their own, and inmates were locked up. There were no institutional support. There were similar cases in UK as well, but I think UK handled it quite well in comparison to Spain, Italy, or US. Moving on, gender and biopolitics. Why is it important to kind of talk about gender and biopolitics in Corona? I mean, especially in pandemic. Somewhere I feel the whole biopolitical conceptual framework is indispensable to kind of better understand the centrality of gender, reproduction, sexuality, and race, where, we exist in the space of capitalism, sovereign nation state, uh, administration, regulation, disciplining, all of these different ways of functioning, different ways of performing our agencies are within this complex web of government, state, capitalism, all of this. So ultimately it comes down to what defines who we are, how we live, and how we die. A lot of the times we have seen, how governments micromanage, they use biopolitical techniques to micromanage population, like techniques of control on birth rates, modulation, homogenization, differentiation. All of these are on women's bodies or non-male bodies. If you see, a lot of the reproductive healthcare programs are on women's bodies, and the trust is more towards disciplining women's bodies versus making it gender neutral. So it is all the more important now with the pandemic, because somewhere the vulnerabilities and somewhere the effects and impacts of Corona is different. How a man experiences impacts of Corona versus how a non-male individual would experience impact of Corona is entirely different. So it's differentially distributed within the population. So I feel it's very important to talk about gender and biopolitics in that frame, to understand how in a post-COVID world, non-male bodies, non-male individuals are going to experience the consequences of Corona. Number of press and research reports kind of showed how, where states, even though they did not implement stark undemocratic measures, but there was a lot of surveillance, a lot of social panics were triggered, and they kind of allowed the criminal justice systems and police police brutalities, not just by state but also by non-state actors. Even in India, we have seen when the first lockdown was announced in around April, the government kind of, we have seen visuals where police were beating up people and they killed people, beating them up because they went to buy biscuits or milk or stuff like that. So it kind of really gave absolute impunity, absolute immunity to state and non-state actors to inflict violence. But most of the times it was a form of gendered violence which was used. Like there's this whole rhetoric about how during Corona, especially in India, all of these lockdown measures, especially with the migrants, we've seen how migrants were treated. And we need to understand that 92% of the population who works in India is from the informal sector. And this is not statistics made up by me. This was a study done by ILO. They've said that 92% of the working population of India is in the informal sector. They are women. So you can see how, how it is differentially, distributed. So even though the virus is democratic, it affects everyone, the effects are unevenly distributed across social formations, and this is traversed by economic structures, by political taxonomies, social inequalities. All of these are kind of different ways of understanding how the whole pandemic affected different section of the population. One very evident illustration is that the large number of infections and deaths amongst Black people in the US and Brazil were quite high. And we also need to understand that there is a gender division of labor in the current world that we're living in, where a lot of the health sector workers are female, a lot of the education sector workers are female, and they are the front line, and they are exposed to higher risk of infection than anybody else. Like I can specifically talk about UK because I've been here during the lockdown and during when all of this was happening. Even now I'm here, I'm experiencing it. What the government did was, lockdown was announced in the month of March, and the government kind of asked NHS. So NHS is a National Health Service in the UK, which is like a social service thing. You pay an NHS fee and you are covered. Your medical insurance is taken care of. So what the government did was they invited people who wanted to be care workers and support workers and come and help the NHS save lives, save NHS. And most of these people who were working in the front lines in NHS were people from the Black community or people from BAME community, which is Black, Asian, minority, and ethnic. All of these people, they were in the front lines helping the UK government tackle Corona. And most of them are immigrants. But now that on July 4th, the lockdown was eased, UK opened everything on July 4th. Now they are firing people from the system. Now they don't want them anymore. They want them to go back. And just yesterday I was reading where government said, so UK borders are closed. I mean, nobody can come in, nobody can go out. And just yesterday I was reading somewhere where government said that refugees who are living in UK would not have access to the services right now because they are trying to control the pandemic with the UK citizens and people who have genuinely come as an immigrant to the UK versus people who are living as refugees. So you see how government kind of decided that refugees' lives are less valuable than British citizens here who had access to NHS. There's another example which I can share is this friend of mine who's from Indonesia. She's a nurse. She's studying nursing in one of the hospitals here in UK. So the thing is, if you come as an immigrant to the UK, you have to pay an NHS fee. So I think I paid about 2,000 GBP for 3 years of my PhD here in the UK to avail NHS service. So she came here to study and nursing. So even though she is risking her life, she's saving people affected by Corona. And, she might herself get infected and lose her life, but she's still paying the NHS fee. And interestingly, when lockdown was announced, government kind of said that, we are the key workers, we really need them. We're going to waive off the parking tickets and we will kind of give discounts to NHS people. They have first access to groceries, essential services and all of that. But now when the lockdown was eased, things just to save the economy, now NHS workers are supposed to pay parking tickets. So you see how governments kind of, just because they needed the services of essential workers during Corona, they really kind of helped them with gave them discounts and waived their parking ticket. Now that they don't need them, they kind of just go back. I mean, some of the immigrants who have been working as key workers, they don't have visas, their visas expired and they were asked to go back. So, and most of these are women. Most of these are frontline women workers who probably are, some of them are single mothers, some of them are immigrants who kind of have been in the UK for a better life. So, yeah, I mean, this is how people were treated. Even in India, Geeta Sen, she talked about how marginalized groups such as Dalits and people with disabilities and poor women were being stigmatized. And in China, when the female health workers, they were asked to shave their heads, who they were working in the front line. So even in China, people who were controlling the pandemic in the front line were females, and they were asked to shave off their heads. And this was the same thing which were which was done with commercial sex workers infected with syphilis. They were asked to shave off their heads. So there's a lot of stigma around women's bodies, you know, long hair might kind of, yeah, I mean, all of these stigmas around women's bodies, women's agencies during Corona was really, really hard on, you know, non-male individuals. It's fascinating because it's also very fascinating with religious institutions and gender and biopolitics, is because a lot of the gender religious institutions were involved in these anti-gender campaigns. They reacted negatively to rules promoting social isolation across the globe. And these were the same institutions who declared that COVID-19 was a divine punishment for legalizing abortion, recognizing LGBT rights, or, you know, fall of fertility rates. So yeah, it's very funny. Even we've seen in India with Baba Ramdev trying to cure homosexuality, and, you know, these are like some of the trends are quite it's quite similar what's happening in Europe and what's happening in India. So I mean, I'm trying to draw parallels here. We have seen how migrants were treated in India when lockdown was announced. They were left on their own. I've seen very tragic visuals of migrants walking from Karnataka to UP, and without any institutional support. Government announced lockdown and they didn't know what to do. Trains were cancelled, it was overcrowded, and all of that happened. All of us have witnessed how the government kind of dealt with the whole migrant issue. But we need to understand that it is not the migrants, it is not the working class, poor working class, who got the virus in the country. It is privileged people like me, privileged people like who travel, who could afford, who, you know, privileged class people who could travel by air. They are the ones who gets in the virus in the country. And they were treated differently. I know a lot of my friends who flew from India to, from UK to India, they were treated differently because, you know, they were kept in good hotels and, you know, good institutional support, whereas migrants were dying. And, you know, there is a striking visual I remember where I think this was state of UP, where there were migrants, they came into UP, and this was, I think, in a newspaper, where they were sitting on the on the street, and people, there were like 3-4 police people wearing hazmat suits spraying chemicals on them. But the same treatment wasn't done to people who could travel by air, and there were evacuations being done by Air India from UK, US, Australia, on Air India flights. You know, people flying into India, they were quarantined in good 5-star hotels, and every luxury was provided to them. So see how governments kind of, there's this differential treatment about class, and, you know, gender. So all of these are very minute, magnified ways of looking at how consequences, impacts, and effects of corona is differential across like different social formations. Moving on, I'm going to quickly talk about the pandemic citizenship. I think it's very important, not just because it's my PhD project, but also because India passed the Citizenship Amendment Act in December, I think December 10th or December 9th. And from December 11 onwards, there were massive protests in Assam and in Northeast, and, you know, it spread over to the mainland India. And we all of us have been witnessing the contestations that happened within Northeast India and the mainland India, how mainland India hijacked the narrative. So all of these complexities, subnational contestations about the citizenship is at one hand, and the other is how Corona, the pandemic, kind of escalated, kind of really magnified the hatred, exclusion, marginalization at an unprecedented level. So if you look at the government's response and the rise of anti-Muslim hatred around the virus, we can see how there is a certain form of biopolitics of pandemic citizenship is happening in India, especially with Shaheen Bagh. I don't know if you guys have observed, and this whole narrative that, you know, Shaheen Bagh women are spreading corona. So Shaheen Bagh happened in January, from January to around February, for a month. And this whole media outrage about Tablighi Jamaat, it was like all over media, and all the media houses were showing how Tablighi Jamaat, people who went to Tablighi Jamaat were spreading the virus. And, you know, but it's very important to understand the institution of media, which is supposed to be the fourth pillar of democracy. They were biased all around because, you know, they were trending hashtags about Corona Jihad, Corona Bomb Tablighi. Tablighi members were not just quarantined, they were also arrested. In Gujarat, there was this hospital. They had separate corona wards for Muslim and Hindu patients, and this was this was an order by the government. And all of these kind of, this whole right-wing media kind of really escalated this anti-Muslim hatred, and they use corona kind of as a platform to escalate the hatred. And this while Trump, who visited India in February, he came around 24th and 25th of February, if I'm not wrong. He was in India. There was a massive mass gathering of people in Ahmedabad in Gujarat, and nobody talked about it. No media channel highlighted that could also have been a ground of spreading the virus. But it was only on Tablighi Jamaat, only on Shaheen Bagh, and all of these kind of hashtags kind of really escalated this, magnified and escalated the anti-Muslim hatred. And yeah, so India knew about corona. So Wuhan was locked down, went on a complete lockdown around January 15th, if I'm not wrong. So all countries who issued the notification about corona and that it's a pandemic around 15th of Jan, 15th or 20th of Jan. So all countries knew about the pandemic. And Trump came into India on 24th and 25th February. And there was a massive gathering in Ahmedabad, but no media kind of really put this narrative out that, that could also have been a ground where, mass spreading of the virus. And interestingly, Supreme Court kind of granted, allowed the Jagannath Rath Yatra to happen even within the corona pandemic now. And we've seen how a lot of BJP politicians and a lot of, not just BJP politicians and their sons and their daughters were getting married, weddings were being held. And nobody questioned, no media questioned that, all of these gatherings. And this was somewhere we saw how differential treatments were given to people who belong to a certain class and people who had access to the government and had political connections. So you see how all of these, how corona pandemic was used as a platform to really exclude, marginalize, discriminate people, and on the basis of their religion, their gender, their caste, their class. So COVID kind of exposed these realities. So there is this very popular saying in the UK, I've seen banners here which says, even though we are together in the storm, which is the COVID, but we're not together in the same boat. Someone's in a yacht and someone's in a wooden boat without any help. So you see, we need to understand how COVID kind of really expose who gets to live and who gets to die, and how governments treat people, how governments treat their population. So we as citizens from a democratic republic like India, I feel it's all the more important for us to kind of really hold power to account, really ask difficult questions to our MPs, to our government, question them as to what is the overall plan. And you see countries who kind of really did well in terms of handling the virus were led by female presidents, like New Zealand, Germany, Finland, Denmark. They've been doing really well in handling the whole pandemic, versus countries like UK, US, India, Brazil, where the male presidents and prime ministers with their egos trying to do something, but it hasn't been as effective as other countries who were ruled by women, governed by women. So especially I've seen Bolsonaro, who's the Brazil president. He was totally ignorant about the virus, and he said, we don't believe in this is bullshit. But he himself is affected by COVID now. Similarly, in UK, Rishi Sunak and Boris Johnson, they said that, we're going to test out this herd immunity concept. And, we had the time to kind of really come up with really good measures, but they were like, oh, we'll test out herd immunity, we'll see how it works. And then they realized that every day people are dying in large numbers, and then they announced lockdown. So you see how this whole issue about power and who gets access to power, who has more power during a pandemic, all of these are really important to understand. And we as citizens, we need to really hold power to account, or not just because we're experiencing the corona pandemic differently, but also because it's all the more important we as citizens from country like India to really question our government in terms of what is the long-term plan that we have to deal with corona. So yeah, I mean, there are no concrete answers to the questions I'm raising, but somewhere I feel all of us need to be more aware about how biopolitical powers are used during a pandemic, and what we can do in terms of in terms of asking difficult questions to governments. And that is the end of my presentation. I hope I haven't taken long. Over to you, Bauji.
Yes. Okay, then what an invigorating delivery across. I believe over the entire delivery, over your entire platform that was given to you, I think a lot of key points, a lot of key issues, a lot of happenings have been clearly identified and exhibited very well. And I think there are still so many more questions that have just been thrown to everyone to understand. So any questions, the digital platform is open. In case there are any queries, please put into the chat box and I'll take them one by one. I believe nobody has any questions.
There can be two reasons. Either people did not understand anything, or they're like, this is very boring.
No, there is a question that comes from Ananya Gogoi. She just writes, what about resistances? That's the very thing that she has to ask. What about resistances?
So resistance is a very subjective term. We need to I need to understand, when you say resistance, do you mean resistance from the people or resistance of the government? And it's a very subjective way of talking resistance. I feel in terms of resistance, if you look at how people are resisting, resisting or subverting a lot of government restrictions and lockdown. We've seen during the month of January and February with the anti-CAA protests happening in India, a lot of the youth coming out and kind of protesting against the government and their draconian policy. But because Corona came at such a time, right after the Citizenship Amendment Act came in, it kind of really helped the government to curb democratic voices and really kind of pinpoint on, we have seen arrest of Devangana Kalita and a lot of the youth activists who were protesting against the government for CAA, even Akhil Gogoi from Assam. A lot of the civil society leaders were arrested during Corona. Varavara Rao, Akhil Gogoi, Devangana Kalita, I'm forgetting names, but Zafur was also arrested. She got a bail recently, I think 2 weeks back. So these government kind of used Corona to kind of really curb democratic voices. Having said that, I think it's important for everyone to understand that once we lose our civil society actors, civil society youth leaders or youth activists, we are losing our democratic voice. So it's very important to stand with them, to kind of raise voices, not just kind of go out there rally and risk yourself of the infection, but spread messages through your social media accounts, Instagram, Twitter, okay for governments to arrest young leaders who were anti-CAA protesters. Yeah.
All right. I think she has reframed her question. This is Ananya Gogoi again. She writes, what about resistances against this state-generated biopolitics? Yes. The same query?
Yeah. Resistance is generated against state. Sorry, can you just repeat the question?
It is, what about resistances against this state-generated biopolitics?
It's very, we'll have to be observant about resistances against state-generated biopolitics. At one hand, like I said, it is important for governments to introduce the plague model of power because we did not have statistics. And somewhere we knew that, if we go out there, we're going to risk our lives and, we'll get infected. And most of the young population from like 20 to around 40, we would be the carriers of the virus. So, yeah, state-generated biopolitics, states knew that, this is a thing which affects certain sections of the population more than like others. So the resistance, I say, on one hand, it's a very dicey situation because at one hand, I've seen how a lot of young people, they were out, they did not listen to government, they went out and, they went out, met their friends, and really, yeah, they're in the public space. We have also seen in India how people were violating lockdowns and they went out, and there were a lot of police brutalities. But I somewhere feel that at one point in time when the virus kind of really affected, deaths were high, and the government needed that model to kind of control the infection. So we as dutiful citizens, we complied with the government, but also people who broke, who violated, who resisted state generated biopolitics, they were stigmatized. I can tell you one example which happened to me was this was in the month of March. I went to buy groceries. I took a bus from my place to the place I went to buy grocery, and there was this woman who shouted at me in the bus saying that, all those white women sitting by the river, they want to get a fake color like yours, and they are spreading the virus. You guys don't listen to government. You don't listen to government restrictions. So I was like, it is not me who's by the river trying to get a fake tan. I mean, I went to buy groceries. So even those in those moments of resistances, there is a lot of different intersectional identities this plays into like in that. I mean, like, she could have gone and shouted at the white women by the river trying to get a fake color versus shouting at a woman of color who's gone there to like buy groceries. So you see, even those moments of resistances are colored by who you are, where you are from. It was easier for her to shout at me because I'm a woman of color, and then probably she knew that I'm not going to kind of shout back at her. So yeah, I mean, that's how I see this whole idea of how do you resist state generated biopolitics.
Okay, there's another query by Rosalind L. Changsan. She writes, is the UK democracy authoritarian? How, according to you, would you compare it with the Indian democracy in terms of handling the pandemic?
I feel UK and India, in terms of handling the corona pandemic, somewhere they're similar and somewhere they're different. Similar, I would say, because right-wing both governments, and they had this whole idea about herd immunity. UK had this idea about herd immunity. There were a lot of talks by Rishi Sunak and Boris Johnson initially talking about, oh, we will create herd immunity bubbles, we'll let the virus spread within the young population, they'll develop their own immunity. And then they suddenly realize that people are dying. I mean, even young people are infected and they're dying in hospitals. And UK has a big population of people living in care homes and nursing homes, even they were dying. And then they announced lockdown. But in UK, somewhere the lockdown wasn't as aggressive as in India. Having said that, it is possible because UK population is less in comparison to India. I mean, UK is the size of Rajasthan. So population is less in compared to India. So they could really introduce liberal measures of lockdown. I mean, I could go to the supermarket, buy groceries. In India, I remember during when the first lockdown happened, people could not even go out of their homes to buy essentials, and people were beaten up and all of that. That did not happen in UK. At least nothing was reported in the news. Of course, fines were imposed, but I'm not too sure, about the collection of fines, whoever violated. But in terms of using violence, I think India was more, the Indian government used more authoritarian, aggressive forms of violence to control people going out and, during lockdown. Yeah.
There's another question by Dr. Rinku Bora. She writes, would you kindly explain as to, according to you, who are the worst sufferers in the post-COVID situation? And if it is women, then how do you compare the Indian women with their counterparts in the rest of the world?
Interesting question. Yeah, I mean, in terms of who's going to be most affected, we all know there is definitely the the most vulnerable population, which is like women from the informal sector, or women who comes in the last strata of the economy. Like I said, in terms of comparing how it's going to affect women from India, there are different hierarchies of understanding marginalization, discrimination. So I would say in terms of UK, I can talk about how women from like the BAME group, Black, Asian, minority ethnic group, they are more vulnerable, they are more exposed to the effects and impacts of post-COVID. And in India, it would be the migrant women, you know, women who work as domestic workers, because they do not have any institutional support. India does not have a social protection policy. We don't have social insurance. So I've seen a lot of stories around how domestic workers, women who work as domestic help, they were, their landlords, their whoever employed their employees did not pay them money, and you know, they were left on their own. What happens is that there's a lot of psychological impact as well, in terms of we've seen the rise of domestic violence cases. In UK it was quite high during lockdown. Even in India it was really, really high. I think I remember, if I'm not wrong, in India, in I think the second week of domestic violence, there were around 3,000 cases which came, 3,000 calls which came up in domestic helpline call. Even in UK, I mean, domestic violence was really escalated during Corona. So most marginalized, most vulnerable definitely are women and non-male individuals. A lot of the people from queer community, they face a lot of abuse because they had to be in a lockdown with homophobic families who kind of did not know that they were gay, or they were from the LGBT community. And you know, there is this instance where they needed support and there were no support. We do not have adequate support for the LGBTQI community in India. So they could not reach out to anyone. Parents kind of really getting hold of their phones and checking up their messages, and you know, they were beaten up. There was a lot of violence. So it's always, so there is this concept called hierarchy. I don't know if you guys know about it. It's a step away from patriarchy. So hierarchy talks about how privilege and oppression is situational. So it depends on where you are located in that particular point of time. So I would say, for example, just to make it very simple, what hierarchy is, I am a woman of color. So my position in India is that of a caste privileged woman who had access to opportunities, who had access to resources. I have had some of the best education in my life because my parents could send me to private school. I had access to good education. I was working in good organizations. I had access to money and all of these. In UK again, when I come here, I am a minority because I'm an immigrant woman. I am a woman of color, and my vulnerability is more in compared to a white woman who is a British citizen. So this is what hierarchy is. You know, it is your privilege, your oppression is very situational according to your context. So in terms of the post-COVID impacts of marginalization, discrimination, and all of this, it is also
Any more queries, please? We are there for another few more minutes and then we can sum up. Any more queries? I believe there are a lot of, people have a lot of good things to say. Madam, the entire discourse was very interesting. It was wonderful. It was insightful. Thank you very much. And then nice presentation, ma'am. Thanks once again. Wonderful session. Then again, nice presentation, very nice presentation. We thoroughly enjoyed your presentation.
Thank you so much.
It was very informative, very interesting. Somebody writes, it was nicely articulated. Somebody writes, nice and an informative lecture. Summed up beautifully to portray it as a bouquet in front of all of us.
Thank you so much.
That's what everybody, most of them are writing. I have just summed up the compliments and comments and I have just read it out.
Thank you so much.
Before we move further, are there any more queries? We can take, I think, another one more question if possible. If permitted, can I ask a question, please?
Yeah, please go ahead.
My thing is, like, you know, we talk so much about policies and programs, pre-COVID, post-COVID. Now this new thing is going to be there. But then everywhere, you know, there is so much of, you know, human rights at stake and all. Then the entire idea of having human rights you know, it basically seems so farcical actually,
Yeah, of
because
course.
when everything is so grossly violated, you know, right in front of your eye, what is the idea of having the, you know, women's rights, queer rights? What is the idea of having gender rights at all? I mean, you know, if
Yeah.
nothing is actually done except for the privileged lot to get everything.
Mm. Yeah, interesting. Actually, it's more an observation than a question. I kind of
Yes,
completely
yes.
agree to what you're saying. But somewhere, I think it's important to understand that human rights is a gender neutral term. And it's just the same argument we have about Black Lives Matter and all lives matter. So until unless you magnify the violations, the exploitation of a particular population who are traversed by their own vulnerable and structural inequality, you will not get adequate focus. Somewhere I feel I'm hopeful because, you know, if we did not have the feminist movement, we would probably not have been able to sit today here and, you know, have this
Exactly.
conversation on Zoom. We'd have been cooking dinners and lunches for our husbands, right? So I feel somewhere, you know, all of us are kind of taking a step further with the feminist movement, with all of that, and, you know, with all of the 4 waves of feminist movement happening, you know, people, it is important because to make noise, to kind of really highlight issues, kind of pushes governments to come up with policies. And having said that, I also am completely aware, completely acknowledge the fact that just having policies will not help have any solution unless and until you implement. Like in 2012, when Nirbhaya rape incident happened in India, the government came up with Nirbhaya Fund. And in 2018, around 3,000 crores were allotted to Nirbhaya Fund. They could have been utilized well, but the next year when expenditure was reported, that fund was underutilized. And a lot of the money was routed to different schemes via Nirbhaya. And 56% of the fund was utilized only for advertising for Beti Bachao, Beti Padhao campaign. So all of this symbolic gender rights is something which we need to kind of question. That's why I keep saying, you know, it's very important to have NGO, civil rights movements, and, you know, civil society people questioning the government. And just having a, you know, having a banner which says Beti Bachao, Beti Padhao will not empower a girl to go to school. So all of these, you know, different issues, different ways of looking at gender rights is also important, because if you just say human rights, it's a very gender neutral term, and it kind of really invisibilizes the gender struggles that we have. So it's important to have like gender rights and queer rights and LGBTQ. More and more discourses need to come up. That's how you kind of really lobby with government, put them in a spot saying that this is the policy you want. So gender budgeting is something which is very unique, where kind of really questions government. You know, you promise, so 52 departments of the government, they are supposed to allocate 10% of their annual plans towards gender budgeting. And you can really hold governments accountable because they signed for it. So all of these different ways of, you know, subverting government's idea about gender rights is very important.
Okay. Before we wind up, I think we can take a final question by Dr. Gunendra Nath Chaudhary. He writes, according to me, I think the number of women unskilled migrant labor in India is the highest in the world. Can you give some idea as to how this workforce can be well organized, well established, because they are easily exploited by all?
Yeah, interesting question again. So very briefly, I worked with a South Asia level organization who were working on the issue of domestic workers and construction workers, especially migrant. You are right when you say that number of women unskilled migrant laborers is quite high in India, not just in India, in South Asia. So I'll give you 2 examples of exploitation that happened and what can we do about it. So in the year 2016, H&M, so H&M is a big fashion brand in Europe. They have their factories in Bangladesh, Sri Lanka, and South India, Hyderabad, Kerala, and Karnataka, if I'm not wrong. Vietnam, Cambodia, Thailand, and Laos. So because labor is cheap there, and they pay like, I think 50 penny, which is about 60 Indian rupees per day for their work. So they have to work 9 hours. And so in 2016, a lot of the people, I mean, H&M, they signed, their board members signed saying that we are going to give minimum living wage to minimum living wage to women who are working in our factories. But in 2018, they bailed out. They said they could not do it. So it's a very simple example. I was in Bangladesh last year. I went to the H&M export house, and one t-shirt, it costed about 150 taka, which is about 100 Indian rupees. The same t-shirt in Europe costs about 34 pounds, which is about 3,400 Indian rupees. So look at the amount of profit H&M is making out of selling one t-shirt. And the kind of exploitation they're doing, they're just paying like 60 rupees to the worker who's made the t-shirt. So this whole exploitation, this whole burden of labor and production is on the women, but they're not receiving any help from their factories. And post COVID, there were these news which came up last week where H&M, Primark, Zara, Mango, all of these are big fashion brands. They did not pay money to the workers who, went during the lockdown. So all of these exploitations are really magnified when it comes to South Asian realities. So I was working with this organization at the South Asia level on domestic workers, and I realized how they do not form part of unions, trade unions, because trade unions in India, trade unions is something which is like a that is the voice of people who work in the informal sector. So domestic workers and construction workers, especially women who are women, they are not part of the trade unions. And this was done particularly because they said that to be able to be a part of a trade union, you need to work certain number of hours. And for migrant workers, you cannot pin down on how, it depends on what kind of work you are doing. Like you have a contract with one contractor for like maybe 6 months of working in one particular construction project, and then you don't have work for the rest of the year. So they cannot be part of the trade union. And what they do is that because they're not part of the trade union, they do not fall under any law. So all of the laws that applies to like social protection laws that apply, does not apply to women workers. And there's a massive exploitation and discrimination because of that. So in 2008, the parliament tabled the unregularized social security bill. So this was to kind of really help the migrant workers come under a union. But from 2008 till 2020, the bill is still lying in parliament. No MP is interested. No MP is interested to raise concerns about migrants. So yeah, I mean, in terms of what we can do, just, of course, we have to raise voices, like I said, continuously raise voices about how the working class experiences exploitation, and especially with COVID, in a post-COVID world, it's important to really raise concerns. So, and also be very conscious when we vote next. When the next elections come up, we don't vote according to our caste or our preferences, or which religion the politician is from, but really knowing that this politician is gonna, even if that means voting independent candidates, but if the person is kind of really committed to work for the working class, I think that's where all our energy should be focused on. Yeah, it's a very difficult question, actually. I mean, it's very subjective as well. Yeah.
Okay, I hope there are no more queries. Before we wind up, I would now request our Dibakar Das, my colleague Dibakar Das, to kindly extend a vote of thanks.
Am I audible? Hello?
Yes, absolutely.
Yes.
Respected Principal Sir of L.C.B College, Dr. Edison Ali Sir, IQAC Coordinator, Dr. Diba Barua Ma'am, respected resource person of today's webinar, Megha Kashyap Ma'am, and my dear colleagues and the respected participants. We are at the end of the webinar, and I am going to offer the vote of thanks on behalf of the organizing committee. So first of all, I would like to offer my vote of thanks to our Honorable Principal Sir, Dr. Edison Ali, who provided us this opportunity to organize this seminar. Next, I would like to offer my vote of thanks to the Honorable Resource Person, Megha Kashyap Ma'am, who has enlightened us through her resourceful academic speech. Thank you, ma'am, for giving us your valuable time in spite of your busy schedule. Then I would like to thank Mr. Bikram Sharma and Dipankar of SS Technology for providing us technical support in the Zoom application. Last but not least, I would like to offer my vote of thanks to all the participants for your cooperation and support in the entire program. Thank you very much. Over to Kunjalata, but before that, I would like to just announce one thing. Hello.
Yes, you are audible.
Yeah, we have already sent the feedback link in the chat box. Please send the feedback and submit the feedback, and we will be able to get certificate in your email. So thank you very much.
Before we finally wind up, I would just like to put across, since a lot of congratulations have come to the organizing team also, and many of them are saying that we are looking forward to more webinars. We have another webinar on the 25th being organized exclusively by the Department of Political Science. I would request all participants to be there. The link will open up very soon for the joining, for the registration for the next webinar that's scheduled to be on the 25th of July. So thank you, everybody. Thank you so much. Thank you, Megha.
Thank you so much. Bye. Have a good day.
Bye.